I'm Dr. Bob Wood. From 1986 until 2010, I was the director of the Seattle King County Public Health HIV/AIDS program and clinical professor of medicine at the University of Washington. The current coronavirus pandemic has reawakened many of the earlier thoughts that generated during my tenure involved in AIDS. These are two different viruses that cause untold suffering and have been transmitted to a huge extent globally. Here are some of my thoughts around the symptoms and the differences and similarities between HIV and coronavirus symptoms, transmission, and stigma. Both HIV and coronavirus are caused by RNA viruses. That's a similarity. Both cause death from pneumonia. In the case of HIV, the most common complication that people got was pneumocystis pneumonia. This is a viral-caused pneumonia with the new coronavirus that kills much more rapidly than HIV did. Most people who got HIV would live maybe 5 to 10 years before their immune system was shot and they became vulnerable to pneumonia. But with the new coronavirus, people become ill, and within days, they can become short of breath and develop pneumonia and die before or even despite ventilation with intubation and oxygen and everything else. Both HIV and the new coronavirus start off quite frequently with a flu-like illness. Something like 50, 60, 70% of people who get HIV have what seems like the flu. I had that back in 1983, which I think was when I became infected. Maybe 40% of both groups, both virally infected people, have no symptoms whatsoever, which makes them particularly dangerous because then the virus can be transmitted before people are aware that they're infected and propagate itself in that way. Almost nobody with AIDS was ever put on a ventilator because what they had was pneumocystis pneumonia, and it wasn't assumed in the early days that if they had pneumonia that ventilation would be particularly helpful because they were going to die if they didn't get the pneumonia under control. Big difference is the route of transmission. In HIV, people became infected through unprotected sex, or they became infected from sharing injection equipment that was contaminated with the virus, or they got a blood transfusion before all transfusions were tested and screened for HIV. As far as we know, coronavirus is not transmitted by blood, but I don't think anybody's done any very careful studies. It wouldn't surprise me that it would be transmitted that way because the virus seems to spread throughout the body pretty fast and can cause muscle aches and pneumonia and sore throat and headaches and blood problems, clots and strokes. And probably the virus, just like HIV, spreads very early after the inoculation. In HIV, within a couple of days of infection, there were like 2 billion viral particles throughout the body, basically in every tissue of the body, including the central nervous system and the kidneys and the liver and the lungs and so on. And when people are really getting sick with coronavirus, I'm guessing that there might be like 2 billion viral particles in those people as well. particularly the people who have coronavirus and are sick seem to have the highest quantity of virus in their uh, cough, sputum, and secretions. And that's true with HIV as well. People who are newly infected and have that initial burst of huge number of viral particles are the most infectious in those early days that they will ever be. Everybody on Earth is susceptible to HIV, and everybody on Earth is susceptible to the new coronavirus. So it's very easy to get infected with coronavirus. It's not so easy to get infected, fortunately, with HIV. Nonetheless, still over 30 million people have died of HIV, and something like 40 million people are currently thought to be infected. There's stigma with both diseases. Certainly with HIV, there was a lot of stigma, partly because of the viral nature of this disease, but also partly because the behaviors that transmitted HIV, other than transfusions, were themselves highly stigmatized. Homosexual behavior and injection drug use are populations that the general community doesn't have a lot of respect for. And even with recent changes in allowing gay men and lesbians to be married, still there's a lot of angst about homosexuality in many of the religious groups and in the general population, particularly uneducated people. In case of coronavirus, the stigma seems to be augmented by our current president by calling it a Chinese virus. And so Asians are being stigmatized in the process, and people are wanting to be angry with Asians for having caused this virus. And some people are developing theories that maybe it was actually developed on purpose, actually just the way HIV was initially sort of thought perhaps to be developed on purpose in laboratories in the United States. In the case of coronavirus, it's laboratories in China that are said to be to blame for this.